Hey everyone, my name is Emaan Chaudry.
And my name is Danielle Solish. And today you're listening to the 20th episode of Seeing Clearly, a pre-clerkship guide to all things ophthalmology. On today's episode, we are excited to be interviewing Dr. Keean Nanji.
I'll just introduce Dr. Nanji. So Dr. Nanji is currently completing his third year of residency at McMaster University and is actually one of our new resident advisors for eye curriculum. He is also pursuing an MSc in Health Research Methodology at McMaster University. Prior to beginning his residency, he completed his medical and undergraduate education also at McMaster University. Keean aims to pursue his passion for ophthalmology through a combination of advocacy, clinical work, and research. His research interests are broad, but he is fascinated by evidence synthesis and in the use and interpretation of patient-reported outcome measures in clinical practice.
So thank you so much for joining us today.
Thank you guys both for having me. I'm really excited for the podcast.
Of course, we're excited to be recording with you. With that, we're going to jump right into our first question, which we asked to all of our guests, but we were wondering if you could tell us a little bit about your journey to ophthalmology and why you chose ophthalmology.
Absolutely. So actually, it's a bit of a funny story. I came into medical school with kind of thinking I was going to have an open mind, but there was two specialties that I wasn't really interested in and that I don't think I was going to pursue. Those were, one was like OBGYN and the second was ophthalmology. Those were like the two that eyes kind of grossed me out. I wasn't too interested in it. And then I was actually on a family placement in my first year. So I was at MacMed, and there's very like early clinical placements. It's 3-year program. So they kind of throw you right into things. So I was in October of my first year. So like right when I was beginning, I was in a family placement. And one of the family physicians in that clinic, her husband is an ophthalmologist at Mac. It's Dr. Brian Chan. And he was there just kind of at the clinic. And for anyone who's met Dr. Chan, he's kind of like the most upbeat, like fun-loving guy. And he saw my backpack. I was still kind of keen initial med student wearing the CMA backpack. And my graduating class was 2020. So he saw that and was making a bunch of eye jokes because he's like, "Oh, 2020 vision, like you gotta try out ophtho, you gotta check it out." And he like literally convinced me that I had to try ophtho. And I told him initially like, "No, I don't think I could do it. I'm not really that interested in it." And he actually like gave me his cell phone number and was like, "Text me, you're gonna come join me in clinic at some point." I was like super kind of him. He's like one of the nicest individuals. And so eventually I felt like obligated, like the staff gave me his cell phone number. I got to join him in clinic. So I texted him, joined him, and then just like loved it. And then kind of kept joining him like once a week throughout pre-clerkship just to try and like learn the basics. And he was kind of like mentored me throughout the process, but very fortunate kind of random coincidence that happened. And then it really led me to pursue ophthalmology. So I think the takeaway from that is just keep an open mind. Even things that you don't think you'll be interested in, you may be interested in kind of down the line. And then kind of similarly to, I'm sure many you guys, many listeners like fell in love with ophtho for all the reasons. It's obviously the best specialty, definitely no bias there, but really nice mix of surgery, medicine, lots of interesting research in the pipeline, good outcomes, patients are happy, nice mix of clinic procedures, OR. I mean, list goes on. It's obviously fantastic, but yeah, that was my journey to ophtho, and really lucky that happened. And yeah, now in my third year of residency at Mac, and really enjoying it.
Well, thank you for sharing that story. It's incredible that you were able to meet a mentor like that and on another rotation too. So it really does show our listeners that you never know when you'll discover a specialty that you're interested in. So thank you so much for that. Now that you're in an ophthalmology program and an ophthalmology resident, could you maybe tell our listeners a little bit about your experience so far and maybe some challenges that you may not have expected to encounter, but also maybe some positive aspects of the program that you may not have expected before you started?
For sure. So yeah, now in my third year, can kind of chat about each of the different years and some of the positive or surprising aspects. First year, for me at least, was primarily off service, and I know things are likely changing as we transition to competency-based medical education. I think they're getting rid of a lot of the off service rotations, but for me, so that was the majority. So 11 out of 13 blocks were off service. But one thing that was really, really nice, and in retrospect, kind of as soon as I started R2, I don't know how I would have been able to do it without this, but we had a full day of ophtho every week throughout the whole year. So we had clinic and some teaching every Wednesday the whole year, which was really nice, like to understand how the clinics work, how the emergency, the kind of red eye clinic works, get to meet a lot of the staff, meet the residents, and then just develop some basic skills. So that was really, really nice, and definitely helped with that transition, because R2 is very kind of challenging, and especially initially on, it's almost overwhelming, because you haven't really done full-time ophthalmology in almost a year and a half to 2 years, depending on when you did your electives. And then you're thrown in running the emergency clinic, which some cases can be pretty straightforward, but you get a lot of like very complex cases. And a lot of the times when you're starting out, you truly don't know what you don't know. So you sometimes don't even know what to like look for and what you may be missing. And so you're always trying to keep a broad differential, and you're almost kind of second guessing yourself. Like, is there something I could be missing here? So it's really challenging in that sense. And I think one of the biggest surprises to me is I never really truly realized like how complex ophthalmology is, and how much there really is to such a small kind of organ. You think as a medical student, at least that was my kind of take home, was like, yes, it's complex, but 5 years will be like a master of the eye. But I honestly, now I'm almost feeling like 5 years isn't enough. There's just so much that goes on, and it's super fascinating, very interesting, and loving the journey. But that's definitely been a kind of something that surprised me, and has been, yeah, an interesting part of the journey.
Can I just ask a quick follow-up question? How did you find the residency program has been in being in such a small residency program?
Mm-hmm. I personally love it. So even before I started R2, I knew like all of the residents in the program very well. Not only that, I knew all of the staff in the whole program like very well before I even started R2, which for me was really nice in terms of being comfortable just asking for help. Because a lot of the times there'll be things that you're not comfortable with your exam, like you're not great at your retinal exam, kind of seeing out to the aura, or whatever it is, you're not comfortable with everything, and so having those seniors there to help you is crucial. I think what's nice about our program, and I'm sure like lots of the programs in Canada are great, but I can speak more about our program, is just that culture is everyone knows we're kind of all in it together. Everyone's helping each other out. And the seniors know you're just starting out. They're always looking out for you before they go home. They're always kind of checking in on you. So I think that was very nice. And I owe a lot of me just surviving R2 to my seniors. Like literally would not, there's can't even count the number of like thousands of times I've asked them for help, like literally. So that's been nice. And I think it's just ingrained within the culture of our program. It could be very different, I imagine, if that wasn't the case. And a smaller program could almost be worse because there's less people to go to. But fortunately, I think we have a really nice group, and that was really nice. And I think just having that comfort with everyone, like when there's resident kind of get-togethers, you get to know everyone. Like when I started, there was only 7 residents or 8 residents, depending on, we alternate 1 and 2 residents every year at Mac. So you really get to know everyone quickly and well, which was something that I really appreciated.
Yeah, that's incredible, especially as you were describing, like having a tougher second year residency is probably incredible when you have such a supportive environment around you. That's awesome. Mm-hmm. Thank you. And now we had mentioned a little bit when we introduced you that you're pursuing a master's. So I was wondering if you could talk a little bit about that. How has it been being able to pursue a master's during residency? How does the process look in order to complete the master's while being a resident?
For sure. Yeah, I think for me, the more and more I got into medicine, and I was kind of even realizing this in my non-optho rotations, it's just how intertwined like research and medicine is. I mean, like all our decisions with every patient is just based on evidence. Like you have, especially at Mac, it's like such a evidence-based medicine is just kind of ingrained into you throughout medical school, throughout residency. And I think when I was reflecting on myself, I feel as though I didn't have the skill set that I thought I wanted to be at for when I would be kind of a practicing ophthalmologist. And I was kind of realizing this, like I just wanted, this was something that I personally wanted to just improve for myself, to make myself a better clinician and just be kind of better in terms of for patient care. So that was something that I realized on my own. I think partly may have been, I think, perhaps it's because I went through undergrad and medical school a little bit quicker. Like I did a 3-year undergrad, a 3-year med school, so didn't have as much time to really dive into research and kind of understand all of that. I think like some of the intro courses in med school are great, and even throughout residency, some of the you learn some of the basics, but it wasn't the level that I wanted to be at. So that was a decision I made, and then the question was, yeah, like which masters would I do? There's obviously like hundreds of thousands of like really well done programs, and then would I take time off of residency? Would I not take time off? If I were to take time, how much time would I go through? A lot of programs have like a clinician investigator program, like a CIP program. Would I do something like that? So then I think once I made that decision, then it was just exploring what was the best avenue. And at that point, I turned to some mentors, chatted with some staff, chatted with some other residents, just kind of to pick their brain. I'm a big fan of their health research methodology master's program here. So that's what I'm currently doing. I think a lot of the pioneers of evidence-based medicine and your Gordon Guides, et cetera, all of those are kind of lecturing throughout the program. And so that was the master's that I wanted to kind of immerse myself in. And then I personally had decided I'm taking 1 year off of clinical work just to try and get the most out of that experience. I think, one, the time will just give me a little bit more opportunity to just really dive into it and get as much as I can out of it. I'm sure you guys feel the same in medical school, but in residency, you're always trying to balance like clinical work, studying, research work, family stuff, friends, et cetera. And so I feel as though I personally was having a difficult time balancing all that and kind of learning as much as I wanted to. So I think having this 1 extra year will be nice in that standpoint. And then I'm really fortunate the program was like exceptionally supportive. They were so supportive with whatever I wanted to do, whether it's 1 year, 2 years, whatever masters. At the end of the day, I think a lot of people, at least in our program, like our program director, assistant program director, it's a lot of work to be in those positions. And in our case, like Dr. Sauguson and Rodriguez, like truly are very passionate about resident education. And they said, I mean, if this is something that you want to do, we'll support it and make it happen, whatever kind of needs to be done. Which is, I'm very, very grateful to them. So yeah, I think at the end of the day, then that's just what made the most sense for me. And it's something that I'm currently doing, I guess, like part-time, and then we'll be taking a year off as of next July. And so far is going well.
Thank you for sharing that. And just as a follow-up question, so you mentioned that you're taking some time off your clinical duties and whatnot. So maybe just for our students that don't know, could you talk a little bit about what a day in the life of you doing your master's while being a resident kind of will look like?
Yeah, so the way I'm doing it, I have to take 5 courses during my program. So I'm taking all of those during my year off. So right now I'm just doing some of my thesis work and some of my it's like a research internship where you just have to be working on some research projects with like a supervisor who can kind of attest that you're doing good work. So I don't think it's probably that different than a lot of other residents, what their work is. I mean, you kind of have your clinic or 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 whatever you're doing from the day, kind of 8 to 5, 8 to 6, come home, and then working on some research work a couple nights of the week for 1 to 2 hours kind of thing. Nothing, I think, like too difficult to balance at this point. And then next year will be more kind of full-time taking my courses. And then right now I'm just finalizing like my proposal for my thesis and stuff. So hopefully we'll start recruiting patients and all of that later on this, I guess in early next year is kind of the goal. And then at that point, hopefully a lot of that will be done in my year off is kind of what I'm planning. So that's at least my approach. I know like lots of people do masters throughout residency. So there's many different approaches. You can do it part-time. I think a lot of people do them in the States as well. I think like the MPH at Harvard and Johns Hopkins are very popular amongst residents. So I think lots of great options and you can't really go wrong in my opinion. But this was, the route that I wanted to take.
That's super cool. Thank you for sharing that. I feel like as med students, we don't really hear about those different options that you can pursue throughout your residency program. So really appreciate that. And so just stepping in a little bit of a different direction here, we have a lot of learners that listen to the podcast. So as a resident, we were wondering if you could provide any advice for our learners interested in applying to ophthalmology.
For sure. I mean, I don't envy you guys. I remember being kind of in your shoes a couple of years ago. it's a challenging, stressful process for sure. There's just so many like very qualified applicants. I think at the end of the day, my advice is one, try and just become like the best version of yourself, like recognize truly like what you are passionate about, what you like doing. I don't think there's like a formula or like a recipe that you have to follow. You don't, and again, this is just my opinion, so take that with a grain of salt. I'm not like a program director. I'm just a third year resident at one program. And so there might be different things at different programs, but I don't think that there's a recipe. You don't need like X amount of publications, presentations. If you're into research, like do that, do your thing. If you're more into advocacy work or leadership, do that. If you're more into medical education, kind of follow those passions there. Because I think at the end of the day, what you're most passionate about and interested in, that will reflect in the quality of your work. So just truly reflect on what you enjoy doing, how you think you can make the best impact, and try and be the best version of yourself in that manner. I think that's one. Two, I think you really need to try and like have a growth mindset throughout the process. All your experiences, try and like read around cases, kind of keep furthering your knowledge base, trying to develop more and more skills. There's a really steep learning curve in ophthalmology. Just even using a slit lamp and like seeing the retina is like challenging things, especially when starting out. So kind of doing your best to try and take that feedback in stride as well. Those would be kind of my advice. Just try and reflect on what you like doing, try and become the strongest version of yourself. And then throughout the whole process, I think my advice for like applications and stuff is just starting really early. My advice would be think of a date that you think would be early and then start like a month or 2 months before that, just because it takes so much longer than you think. And a lot of people in medicine, and I think also in ophthalmology, have like perfectionistic kind of tendencies. And you're going to want to try and perfect every aspect of that application. So just like really start as early as you can. That's my advice. And then when it comes to writing letters, different people again have different strategies. What worked for me, and I think what I recommend, is to have 2 or 3 people that you trust to try and get feedback on. I think anything more than that, it's too hard to concisely kind of convey a message in like whatever 500 words that most schools give you. So I think just having a couple people that you trust that can give you feedback, and you kind of share things with them early, that would be my recommendation. And then throughout like the interview process and like the CARMS tour, it's tough. It's a really unique experience where you're flying across the country or like zooming, I guess, to different schools depending on when you're applying. But my advice would be like not to be too hard on yourself. Like, every single person that I've spoken to throughout CARMS, there's answers that you're going to give that you are going to regret, and that you're going to reflect on and wish you had said this. Like everyone has that. Like, and I think if people are saying that they don't, I truly don't think they're being honest with you. It's just so stressful to give like perfect answers to every interview question. So not to be too hard on yourself. And similarly, if you don't interview at a school that you think you thought you were going to, or you're disappointed, again, don't be too hard on yourself. There's so many strong candidates, and just do the best you can. And I think that'd be my advice to everyone.
Thank you. That's extremely valuable advice. And, as easy as it is for someone to be like, oh, I'm just going to try and be myself and take everything so easily during the process, of course, it's so challenging. So thank you for acknowledging that. With that closes our ophthalmology related questions. And so we're going to finish off with our would you rather related questions, just to get to know you a little bit more. So I'll start off and then Emaan will ask one after. But my question for you is, would you rather never be able to send a text message again or never be able to make a phone call again?
That's a tough
Probably
one.
I'd say never want to send a text message again. I feel like at this point, I'm trying more and more to like put my phone away and not be on it. And it's almost like taking over things because people know you're always available 24/7. So I prefer phones. That's just me. You can have like more of an interaction with people, chat with them. So I would rather still be able to have a phone call rather than texting.
I like that answer. Okay, so next question. Would you rather be the star player on a losing basketball team or ride the bench on a winning one? Or you can pick a sport.
Oh yeah, definitely ride the bench on a winning one. I think For me, I never want to be like the best in the place that I'm at. I feel like you're like the average of the five people around you. I'm like a big believer in like surrounding yourself with like who you want to be around. So I never want to be like the best in a room or best on the team. I'd rather be with people who are better than me, who will make me better, who I can learn from. Obviously, it sucks not playing, but hopefully I could get there at some point. I think like irrespective of the winning thing, like my mentality would be, I would always want to be in a place where people are better than me than me being the best, just because that's limiting my potential growth.
Very wise.
Yeah.
Very nice sentiment to have. With that wraps up our entire episode. So I just want to say, first of all, thank you for joining us, and everyone else, thank you so much for listening to this episode of Seeing Clearly, which again is our pre-clerkship guide to all things ophthalmology. We'd love for you to stay caught up with everything that we have to offer with iCurriculum. So check out our website, www.icurriculum.com, and our Instagram @iCurriculum. And Keean, thank you so much for joining us.
Thank you both. I really appreciate it.